So this chapter is chapter 27, and it's all about different kinds of insurance programs, both health programs and then life insurance. Most likely, you are going to mostly deal with health insurance, although it's a very good idea to have life insurance of some kind. So health insurance, just broadly speaking, is just a plan of some kind that prevents you from having to pay catastrophic costs at a hospital at the very least, or even doctor's visits. So it shares the total risk among all the people that have signed up for the plan, and it's basically via a pool. The more people that you have in the plan that are healthy, the better the costs of that plan will be. They'll be lower. In exchange for paying premiums on a monthly basis, you and the insurer have an agreement where they will promise to pay for medical expenses that are incurred while you are under the policy. So there are a number of different kinds of policies that you can go after, but most people are going to be in a group policy of some kind. This actually represents about 70% of the people that are covered under insurance. So in a group plan, everyone has the same exact policy. And because it's a group plan, you can now negotiate to get better rates. You can get better coverage and you can get better premiums. The actual outlines of the plan get better, and also the monthly costs go down. That's the premium. Sometimes you'll have an employer that will actually pay for a portion of the premium. Others will have ones where they have to pay, or somewhere in between where you pay a percentage of the cost of the premium. The insurers cannot cancel a person that is covered under the insurance policy when they're under group insurance. And actually, the Affordable Care Act also prevents anyone from being denied because of previous conditions. There's also COBRA. So COBRA is the Consolidated Omnibus Budget Reconciliation Act. And basically this means that when you lose your job or leave employment for whatever reason, you can continue to hold on to the insurance that you have for about 18 months before you get a new job and get under a new group policy. It's basically when you leave and switch jobs. There's also something called double coverage, or usually most people refer to it as coordination of benefits. And basically this is a plan that specifies that when you have one or more persons covered by a policy, so you've got two people under the same company of some kind, it means that they will have coordination of benefits, but never beyond 100%. So if two people work for the same employer and they get a plan that covers only 80% of the cost, they can actually have coordination of benefits where they get 100% of the costs covered. But it can never be that you go to a doctor's office and then get paid money. So it's only 100% of the cost. So to talk a little more about group policies, under group policies, there's a Section 125 Flex Plan, or usually referred to as Flex 125. And what this does is it allows employees to set aside money that is not taxed. So it comes out of their paycheck, and it is not taxed. And it is actually used to help pay your deductible for a plan. We'll talk a little bit later about what a deductible is, or co-payments of some kind. A co-payment is when you make a doctor's visit and you pay like $20 or $30 or $40 for every visit that you go to. It's not the total cost of your visit, it's a co-payment. You pay along with the insurer, that's the idea. Or any other health expenses that you incur over the year. That could be things like Band-Aids that you buy. And it's actually a really good investment vehicle for some. Depending on the plan, you can sometimes roll it over from year to year, which means that if you don't spend the money that year, you can use it later. And in retirement, you can also use that money. And so it stays untaxed. It comes out of your paycheck, but you don't pay taxes on it. It's actually a way to protect yourselves from taxes. There are different kinds of coverage that you can get, and there are 5 that we'll talk about here. Basic health insurance is going to include medical costs that you get incurred when you go to a doctor, a hospital, or any kind of surgical cost. Major medical coverage is basically less than basic health insurance. It is just for when something really bad happens, a catastrophic situation, you must go to a hospital. A stop-loss provision is an insurance clause that caps or sets maximums that the insured has to pay during a calendar year. They have to pay out a certain amount. And then there's two other kinds of plans that you can get, and not all places provide them, but when you look for a job, you want a place that would hopefully have more rather than less in terms of the plan. It's not just the money that you're getting paid, but also the part of the compensation package is the actual healthcare piece. And two things that you might get there as well, besides those health insurance elements, you might also get dental services. And there are usually some restrictions on what you can get within a calendar year of some kind. You can get exams, cleanings, x-rays, and stuff like that. And then there's vision, sometimes referred to as vision, other times referred as eye services. Okay, so other kinds of plans. You can have a whole plan of healthcare, which would be like your major basic healthcare, can be managed or unmanaged. So unmanaged means that you can go to any doctor that you want. Managed means that you're told that you have to go to certain doctors within a network. Basically the difference between the two of them. So unmanaged care, traditional fee-for-service. It allows participants to choose any doctor they want. They get reimbursed as long as it goes up to the deductible. Usually around 80% of the total cost incurred after the deductible is met. So let's say you've got a deductible of $100. So you go to the doctor, you pay $100 for that first visit, and every visit thereafter, the insurance provider will pay up to 80% of all the costs. So you just pay the 20%. So if the bill was $1,000, they pay $800, you pay $200. So reach the deductible of $100, and then after that, they pay 80%, you pay 20%. Managed care, you can't go to any doctor that you want to. So there's two kinds there. There's the HMO and the PPO. HMO is a health maintenance organization, and it's a group plan, usually, offering prepaid medical care to its members. So you can only go to certain doctors, and sometimes you have to have referrals for them. There's another kind called a PPO, and it's a preferred provider organization. It's a group health insurance program, just like the other, with certain doctors, certain hospitals, for example, who banded together to provide health services for set fees they already negotiated. Usually under the other kinds of plans, every single time they're negotiating with the doctor, because it's all different kinds of doctors. This is just a smaller set. And then finally, there's a POS, a point of service plan. It gives people more choice, control over medical services by combining the features of HMO and PPOs. Usually, the more choice that you have in terms of the doctors that you can go to, usually that means that there's a trade-off there, and that trade-off is that you're going to pay a higher premium. And so usually the unmanaged care is a little more expensive. So there's also something called a health savings account, and it's used in association with a medical plan that has a high deductible. It's very similar to the Flex 125. Money set aside to pay medical expenses and that are not paid by insurance, and the contributions are also a tax deductible. So if you put money into this plan and you spend it, you can use that as a tool to pay less income taxes. An employer sometimes will also contribute to this plan a certain amount a month, let's say like $75 a month. If you have a very high deductible, it's like $4,000, and they also happen to provide $75 per month. Well, in actuality, that deductible is quite low. It's not low, but it's lower than the $4,000. It's 75 times 12, and then subtract that from the $4,000, and you get what your real deductible is. Your in quotes real deductible, and sometimes those monies that you put in there will roll over from year to year. So that's a nice little plan as well. Then what do you do if you cannot afford healthcare or you turn 65? So we have two programs that were started called Medicare and Medicaid. Medicare, we always say care for the elderly and aid to the poor. So Medicaid is for people who are below a certain income threshold, and that's basically determined by the federal rate of poverty. So family of four, poverty line. If you are below poverty, you will then get offered free health care provided to you by the government. That's what this is. It's free health care provided by the government. Means testing. You have to have a certain, you have to fit a certain category. So if you're a person who's living below the poverty line, you are eligible for Medicaid. You have to enroll and go through a whole process to make that happen. There's also something called Medicare, so care to the elderly. This is when you turn over to 65 years old, you get free health insurance provided to you by the federal government. But you have to reach 65. And then there's other kinds of plans. There's disability, and then there's also life insurance. So this will round out the chapter for us. Disability. Basically, this is for if you were to get sick and you could no longer work, this would make it so that you can get paid. Most disability insurance you get provided for by a private company, like health insurance. Most people are under private health insurance, even though 70% of it is a group plan, it's still private. It's not provided to you by the government. But what it does is it ensures that you basically make a payment monthly, and then if something were to happen where you can no longer work, they would pay for you. They'd give you a payout, depending on the kind of plan that you get. The common types of disability insurance are sometimes called group disability insurance. It's just like group health insurance. The whole company is creating a whole policy, and premium rates are going to be lower, and the actual terms of the service are going to be better. You have Social Security disability insurance. That's an insurance that is provided very much like Medicare, Medicaid, in that it's actually funded by the federal government and it's also means tested. And then finally, there's workers' compensation insurance. So that would be if you were to get hurt on the job, you also get paid out. Now that is something that you pay via your paycheck. There's actually a workman's comp that you pay for, you and your employer. Okay, and then finally is life insurance. So this is basically if you were to die, the people that are next of kin to you or people that you name in this plan would get a payout of some kind. So there are different kinds of life insurance. So there's group life insurance plan. That's where if you work for an employer and they're providing you an insurance plan that will make it so that you can not be worried about if you were to die and no longer could work, the people that you name as beneficiaries to this policy would get that money. You can name a lot of different kinds of people. You can name your parents, you can name a partner of yours, you can name a sibling of some kind, or anyone that you choose. So of these kinds of plans, you also have a temporary life insurance. This provides protection for a specified period of time. So let's just say like 10 years. So maybe you do it when you're 70, and then you think, after I turn 80, I'm fine. I got money set aside in some other way. Or maybe you want to do it for 20 years or 30 years. This basically what this does is it lowers the cost. If you just get term life insurance, that it's another kind of way of limiting the cost. It's for a set period of time. Or you can get permanent life insurance. So that provides lifelong, so as long as you're alive. And it actually is nice because this kind of policy has a cash value. What that means is that you're putting all this money in all throughout your life, or all throughout the time that you have the insurance. And then if you decide at some point you no longer want to have the policy anymore because you have other means to protect yourself, the money that you put in if you cancel the policy, there's terms that are set up to determine how much money you would get back in the end if you were to cancel it early. And there are 4 types of permanent life policies that also all have cash values in them. It's kind of like an investment vehicle of some kind. Whole life, limited, pay life, universal life, and variable life. And then there's a couple of key elements of life insurance that are important to remember. One is portability. You should be able to continue to pay the premiums even after you leave your employer if you're under a group plan. You have also the right to name your beneficiary. If any person that you choose, they don't name the person for you. And there's something called the incontestable clause. It's a provision of life insurance policy that once the policy has been in effect for a certain amount of time, let's say 2 years, the insurance may no longer question items on the application in order to deny coverage. So after you're in there for 2 years, if they find out that you've got cancer, they can't actually determine that they will cancel your policy before you were to pass. But if you went in with the policy with a disease or something that would be, according to their actuarists, that would be very risky for them to hold on to a policy, they actually have the right to cancel, but not after 2 years. And then finally, double indemnity. means that the beneficiary is paid double the face value of the insurance policy. So that's all the different kinds of insurance policies.